everyone, thanks so much for joining me today and welcome back to Time with Lydia the Pharmacist. Today I'm going to be talking about something very simple but really important that we know, because this is a condition that when complications develop, it can be fatal. Today we are going to be talking about sepsis. My name is Lydia and this is Time with Lydia the Pharmacist. This is a channel where we educate ourselves on common health problems. We provide advice and information on health and well-being. So please don't hesitate to hit on the subscribe button and also on the notification bell so you don't miss any of my videos. We are going to be looking at the cause of sepsis and some of the symptoms of sepsis that you need to look out for. I'll also provide a bit of some preventive measures that you need to take so as not to develop sepsis. So sepsis is also known as blood poisoning, and it would occur when the body's immune system overreacts to an infection or injury. Sepsis can develop when you even get a small cut on your hand or any part of your body and you don't take proper care of it. Normally, our immune system fights infection, but sometimes for reasons we don't yet understand, it attacks our body's own organs and tissues. And if not treated immediately, sepsis can result in organ failure or death. But the good news is, with early diagnosis, it can be treated with antibiotics. In the UK, for example, 5 people die with sepsis every 1 hour. So it's important that a lot more people are reached with this information. You know, sepsis can start as a flu, a chest infection, or a stomach problem, and the symptoms present differently between adults and children. It is very important that when you start developing the signs and symptoms, you seek urgent medical attention so as not to develop the complications of sepsis. So in adults, signs and symptoms to look out for include slurred speech or confusion, extreme shivering or muscle pain, passing no urine at all in a day, severe breathlessness. There can also be a feeling of you going to die. Your skin can become mottled or discolored. If you spot any of these symptoms, it is advisable that you visit your accident and emergency. In the UK, you can call 999, which would get the accident and emergency department to get in touch with you straight away so you can get the necessary help. I'm sure in the country where you live, there would be a protocol that you would have to follow so as to get urgent medical help. A child may have sepsis if he or she is breathing very fast, if they have a fit or convulsion, if the skin looks bluish or pale, if they have a rash that does not fade when you press it. The child becomes very lethargic or difficult to wake. When the child feels abnormally cold to touch. If you spot these symptoms, call 999 if you live in the UK, or go straight to the accident and emergency department. A child under 5 years may have sepsis if he or she is not feeding, is vomiting repeatedly, has not passed urine for 12 hours. If you spot any of these signs, call 111 or see your GP and just ask, could it be sepsis? You know, anyone with an infection can get sepsis, but some people are more likely to get an infection that could lead to sepsis. And these include babies under 1 year, particularly if they are born prematurely or their mother had an infection whilst pregnant. People over 75 years, people with diabetes, or people with a weakened immune system, such as those having a chemotherapy treatment or who recently had an organ transplant. People who have recently had surgery or a serious illness, and women who have just given birth had a miscarriage, or had an abortion. It's important to note that you cannot catch sepsis from another person. It happens when your body overreacts to an infection. But there are ways that you can prevent yourself from getting sepsis. And it's very important that we all follow these preventive measures so as to avoid developing sepsis. And these include keeping up to date with vaccinations, particularly for babies, children, older people, and pregnant women. Clean and care for any wounds. Take antibiotics correctly. That is, if you are prescribed antibiotics for 5 days, make sure you finish the course. Don't take it for a couple of days, and once you feel better, stop taking it. It's important that you finish a course of antibiotics when it is prescribed, whether it's for 5 days, for 7 days, for 2 weeks, or a month. You need to finish the course as much as possible. And wash your hands regularly. And teach your children how to wash their hands well. Also, don't ignore the symptoms of sepsis. This is very important. Phone the accident and emergency, that is 999 if you live in the UK, to get medical attention immediately. Sepsis can be treated if diagnosed early. I hope you have learned something new today. Please give this video a thumbs up. Share with family and friends, and if you haven't yet subscribed to this channel, please hit on that subscribe button and also on the notification bell so you don't miss any of my videos. Also, I want you to leave me a comment in the comment section. Tell me if you've ever had any experience with sepsis, if you know anyone who has ever had these symptoms before and what you did. And I also want to know, when you are prescribed an antibiotic, how do you take it? Do you finish the course, or you just take a couple of days? Once you're feeling better, you stop taking it. I'll be very glad to know. Thank you so much for your time today, and I hope to see you soon in my next video. Bye for now.